This meeting is being recorded.
So first of all, I would like to welcome Uta for this session that she has accepted our request to present her thing for the our institute. We are really obliged that you are here. And regarding Uta, for everyone else, what I would like to say is that she is a German national. And she's one of my favorite homeopathic doctors in all over the world, whom I can see. She's a very very humble, very modest, and there are so many adjectives I can put for her. Regarding her as a person, I can say that. And regarding what the teaching part is, that we all will be coming across in the coming session. So coming to the little bit of the educational background that she is having, she's a BSc and an MSc in homeopathic medicine. And there is one very prestigious homeopathic journal and a magazine which has been started and edited and whatnot by her. That's by the name of Clever H. And she has been promoting homeopathy in various ways, and she promotes this gentle healthcare system by keeping the community informed with the publication of practitioner articles. And we would really love to hear you today regarding what you have to say for our small topic of skin from your side. So I'll hand over the mic to you for some time.
Okay. Thank you so much, Dr. Shilpi. I am really pleased to be here, to be given the opportunity. Dr. Deepak, thank you very much. Dr. Shilpi, your kind words, thank you so much. I'm very flattered to be given the opportunity to speak here. I know both of you, Dr. Deepak and Dr. Shilpi, from our work at Homeopathy World Community. And I love working with you together, so thank you very much. And well, let's get started. I was going to look at skin diseases from a bit of a different angle, from not strictly speaking homeopathy for various reasons, but it's a very strongly related view I'm coming from, because I would like to look at the Schüssler salts, or the cell salts, which are also called functional tissue salts. They are homeopathy, but yet they are not homeopathy. I think they are a very underused tool in our toolbox that we should use a lot more, and that have a lot of potential. So I've sort of split my presentation in one part where I would like to generally explore the salts in a little bit more depth, because I think we also don't really have the real grasp of this tool in our toolbox. And then I would like to hone in on some skin diseases and their homeopathic remedies, or their Schüssler remedies, because they are homeopathic, but they're not homeopathic. And I will go into the details on why this is so in my presentation. So Dr. Shilpi, if you would like to, or Dr. Deepak, if you would like to bring on the first slide, then I would start presenting this presentation.
Yeah, just a minute.
Mm-hmm.
So this is about you, okay? And now.
Thank you.
Yeah.
Okay, perfect. So as I just already mentioned, the cell salts, they're Schüssler salts, but they are called cell salts in the English language. Schüssler was a German homeopath. They're called referred to as cell salts, but they're also called functional tissue salts, or actually tissue salts. In German, we refer to them as Schüssler salts. So I will go into more detail on that later on. Remind yourself of those names, because they do mean the same thing, but they come in different well, depending on what country you're in, they are likely to be called a little bit different, but they are all the same thing. So Wilhelm Heinrich Schüssler, the so-called founder of the Schüssler salts, he was born in August of the year 1821, actually on the 21st of August. He was a writer. He spoke many languages and was actually a language teacher in his first career, or with his first academic hat. He became very interested in homeopathy because his brother was very persuasive and tried to convince him to take up the studies of this medicine that he had come across. And Schüssler actually went to study at the University of Paris, in Berlin, and in Gießen to become a homeopath. So, well, he had a very unusual academic career. It was not fully known how he was actually able to enroll at university, because he had not actually graduated with a high school diploma, so to speak. He received his doctoral degree from the University of Gießen, albeit not having actually a high school diploma. And that was something that you needed for admission to university at the time. But he became a doctor from the University of Gießen, albeit not having this documentation. So this is a very strange academic career evolution of someone even at his time. He was only rejected from taking the medical state examinations because he didn't have a high school diploma, or a high school leaving certificate, as they were called. And he actually had to go back to school or study further semesters at the university. And he went to the University of Prague, where he took a high school graduation examination. And with that certification, then he was admitted to taking the state examination and became a doctor, a physician. So he was licensed to practice by the year 1858. And he settled as a homeopathic physician in Oldenburg and ran a homeopathic practice for 15 years. So he was actually a classical homeopath at one time in his life. Next slide, please. By 1862, his medical thinking and his approach became very influenced by contemporaries investigating the sciences at the time. And there was Rudolf Virchow, Jakob Moleschott, and Justus von Liebig. They found new concepts of diseases and were investigating. And as a consequence of their findings, he became very interested in knowing the background of things. So he began questioning homeopathy, he began questioning other things in medicine and that he came across. So one prime question that you can read about in documentation is, what is substance? The lack or reduction of which can promote disease to be induced or maintained. And this sort of thinking led him to reorient, and he began distancing himself a little bit from homeopathy. And von Liebig had generated a law of minimum, and Schüssler began applying this to the human organism. I mean, von Liebig did agricultural research at the time, but still his law of minimum became very interesting to Schüssler, because this law stated that plant growth was dependent on the substances of which there was greatest lack. If this lack was then rectified by addition of said substance that was missing, the plant could grow to full potential. Now, this was interesting because this meant that a deficit in the human organism could be corrected by supplementing with a mineral substance of which there was a lack of. So Schüssler assumed that to restore a deficit in a cell, he could correct this by giving what was missing to that cell. He called this system of giving cell remedies functional remedy application or administration. He wrote a booklet about this, which is in English called Abridged Therapeutics. In German, it's called Eine abgekürzte Therapie. This introduces the concept of the tissue salts. And there it says that the materials that remain of the cremation of a body, the constituents of these ashes, are as much the makeup of the tissues as are the substances that volatilize in the process of cremation. And at that time, Schüssler identified 11 residual anorganic substances that are normally contained in the human tissue and in the blood. A 12th substance, namely calcium sulfate, he withdrew from the list. Initially, there were 12, as he was not very clear about whether or not this substance was contained in the tissues of the organism. But a little bit later, he added this substance back, making up the 12 tissue salts as we know them and we can get them today. So there's the list of the 12 initial salts with, as you can see, calcium sulfuricum added at the bottom. So the salts were calcium fluoratum, calcium phosphoricum, ferrum phosphoricum, kalium chloratum or muriaticum, kalium phosphoricum, kalium sulfuricum, magnesium phosphoricum, natrium chloratum or muriaticum, natrium phosphoricum, natrium sulfuricum, silicea, and Z calcium sulfuricum. Next slide, please. Now, Schüssler died in 1898 after he had suffered a stroke. And he has been quoted saying that his treatment approach with the Schüssler salts was not yet perfect, but perfectible. And he asked his followers and his students to make it perfect. He requested that fellow physicians contribute their knowledge from research to assist the development of his approach. And following his demise, his students and followers of this biochemical therapy, which is another name, biochemic Schüssler salts or biochemic cell salts, and complemented the list of these 12 functional tissue salts by another 15 remedies. So we ended up with a totality of 27 tissue salts. But this is a very inconsistent list because nowadays, as we know, various homeopaths have added some more remedies to this list. So we now have different sources quote different remedies as, yet again, adjunct salts to these cell remedies. So we are now maybe at something over 30 remedies that are considered in the community as being Schüssler salts. But we're talking here of the Schüssler salts, the primary Schüssler salts, but I've added a list of these adjunct salts, as I call them. As you can see, it's now up on the slide. That's kalium arsenicosum, kalium bromatum, kalium iodatum, lithium chloratum, manganum sulfuricum, calcium sulfuricum, Hahnemanni, and pay attention, this is kalium sulfuratum, and the other one was kalium sulfuricum, which is the number 12, and the number 18 is the sulfuratum. Cuprum arsenicosum, kalium allium sulfuricum. My slide has gone a bit bonkers here because there's also zincum chloratum, calcium carbonicum, natrium bicarbonicum, arsenicum iodatum, aurum chloratum, selenium, and kalium bichromicum. So the question that always creeps up and that still today people do ask, are these salts actually homeopathic? And Schüssler didn't like the idea of homeopathy in the concept of his salts. So he stressed that the salts should ever only be administered in minimal doses, which is very much akin to what homeopathy is all about. And Schüssler explained that this was necessary because of nature's inability to work with anything other than atoms, atom groups, or molecules. He was convinced that only sufficiently small doses of a remedy had the ability to adjust functional imbalance in the cells without in turn impacting healthy cell function. Furthermore, he believed that only such doses would be absorbed via the buccal mucosa. Higher concentrations, however, would be digested in the stomach and would therefore be rendered ineffective upon contact with the stomach acids. So this is a very plausible, very interesting thought, but we get to the part, that's the next slide, please, where we have to question this a little bit further, because he also stressed that it is not homeopathy. So let me explain that a little bit further. While he placed a particular emphasis on the fact that his therapeutic approach stood in no relation to homeopathy, but as we just heard previously, he did prescribe his remedies in homeopathic potency. And he justified this by stating that his philosophy was a different one than homeopathy. So the homeopathic treatment to him was based on the similimum principle, as we all know. It is based on the similimum principle. And his approach, on the contrary, was a physiological one, a physiological chemical process. Because if a patient was given silica, it was prescribed to his philosophy, Schüssler's biochemical approach, and not homeopathically. He justified this by the fact that you could never give a patient or an individual or a prover, for example, sufficient amounts of crude silica to produce symptoms in a healthy prover. So a homeopath selection of this remedy is therefore only empirical. Schüssler applied this argument to all of his salts. So there is a little bit of a twist in how he approached this, and albeit the fact that he has been prescribing these remedies in homeopathic potencies, he stressed that this was not the case. He also described to correct the mineral disequilibrium of a defect cells with his tissue salts. There's a new paradigmic thinking involved, because his considerations fell short of compliance with the new scientific beliefs at the time. And he believed that the therapeutic stimulus of the homeopathic potency of his remedies, not solely the actual mineral substitution of that, would impact on a cell. As such, a cell's reaction to a pathogen results in the increased activity of the cell that in the consequence causes a functional disequilibrium. Therefore, a potentized remedy gives an impulse to a damaged cell, which regulates the increased activity caused by the pathogen and then adjusts the imbalance in the mineral equilibrium. So albeit fascinated by new scientific findings and the shift in paradigm that was underway, and despite stressing the disparity of his approach to that of homeopathy, he didn't really abandon the older belief system that he had worked in for over 15 years. But let's go into this question of potency a little bit deeper, because he did still prescribe in homeopathic potencies. So while he propagated much freedom in the choice of the potency of his tissue salts, he himself generally resorted to the D or the 6X in the English language regions. Decimal potencies are referred to as X potencies. In German language countries, we refer to them as D potencies. D decimal. In England or the English language regions, we mention them as 6X potency or 12X potencies. So he resorted to the use of 6X, 12 eggs and occasionally a 3x or a 4x. Yet he was, in all his writings, still stressing that it was more beneficial to use higher potencies as opposed to the lower potencies and to administer more repetitions of the higher potencies. Now, I could not find any resources clarifying this in depth, what he meant by these higher potencies. And up until today, if you go into a pharmacy or a health food store and you buy a Schistler salt or a cell salt, you end up getting, generally speaking, a 6x, sometimes a 12x. So has been my finding. I might be wrong, but that's what I've been finding. Yeah, there we are with the Arndt-Schulz law, which is a very interesting law, because the Arndt-Schulz law defines and explains the doses of the cell salts. And this law states that a light impulse will sort of kindle the vital force. An average impulse will give the vital force strength, and a strong impulse will weaken the vital force. And an even stronger impulse will paralyze the vital force. So if the carrier substance of the salt tablet contains only traces of a mineral salt, these can penetrate the cell membrane and will be activated there. Higher concentrations of mineral salts, on the other hand, cause the cell membrane to be blocked off so that nothing gets into the cell. So no mineral gets activated in the cell. So this is a bit of a safety mechanism of the cells. This explains why the potentized cell salts pass through the cell membrane and are intracellularly active. And for example, electrolytic drinks cannot penetrate the cell membrane. They do not impact on an intracellular level. They get metabolized in the stomach or in the digestive tract as a whole, and only act extracellularly. So the identification of the dosage of the salt remedies has to be understood in degrees of deficiencies. So the next slide goes into a little bit more detail about these deficiencies. So if we have a slight deficiency, there are only small few molecules of salts. That means only few administrations are needed to rebalance and regulate this salt equilibrium. In a medium grade deficiency, where the deficiency is a little bit larger, of course, there will be to balance the disequilibrium, there will be a higher rate of salt intake needed. And for a high grade deficiency, where the closer environment cannot supply the amount of deficiency in the salts, the cells need to extract this and transport it from other tissue to the cells from more distant places in the health environment to cause or to get back into an equilibrium. And in a drastic deficiency where the state of health is threatened by this deficiency, these cell salts are not available in the body anymore and need to be supplemented. So the cell salts, one could say, is a replacement therapy. We're replacing the lack that there is in the cells. So keeping the remedy in the mouth for some time is of prime importance for the uptake and supply of the cell salts, because they get activated and absorbed through the buccal mucosa, generally speaking. And as I said earlier on, swallowed, they will be affected by stomach acids and digestive fluids, and the uptake is not given in the same way as it is when the remedy is absorbed through the buccal mucosa. So let's move on to the, there we are, yeah, that was me. Oh yeah, right, I jumped the slide, sorry. Okay, yeah, the administration. Okay, yeah, that's what I said. Yes, the buccal mucosa is important. These cell salts are normally available in milk sugar tablets, but you can also nowadays get them in globules. And they should be given as much exposure to the buccal membranes, because that's the best way to have them transported into the cells. That's what I just said. So the question of dosage. So an initial administration should be of a low doses. That's 2 to 3 tablets per day, because this is important so that the body can adjust its regulatory ability. So there is little information on doses and repetition described in Schüssler's booklet, but he makes a point of it that the administration of 2 of his tissue salts alternatingly should be avoided. Now, this is a common practice that a lot of homeopaths or a lot of Schüssler practitioners actually do, that they give 1 or 2 together or alternating them. However, even Schüssler had exceptions to this rule. Over the years, there have been different modes of prescribing that he adopted, and multiple sources now recommend inconsistent patterns of administration of these remedies, although he has a very strict, or had described a very strict way of administering it at one time in his booklet. So a rule of thumb is in an acute case, 1 tablet or pill every 5 to 10 minutes until symptoms improve. And in the chronic, we're talking 1 to 2 tablets, 3 to 6 times a day. But there are other modes of dosage, which I will refer to a little bit later in the presentation, where they become relevant. Now, observation plays a very important role when we talk of dosage, not only in the confirmation of an appropriate salt, but also in the way it is administered and the duration of intake. So we can go to the next slide, because that will clarify this further. Now, in the application of his treatment approach, Schüssler made use of a very interesting and very useful diagnostic tool. He recommended the use of facial analysis to recognize the mineral deficiency prevalent in a patient and to subsequently identify the appropriate prescription. Now, he describes in his booklet that the power of observation permits an attentive practitioner to recognize in the countenance of the patient which functional remedy corresponds to the presenting case of illness. So according to Schüssler, changes in the texture of the skin, eczema, exudation, could be signs of specific deficits of minerals in the organism. So the practitioner, and at that time it was simpler than it was today, I believe. We have lost the ability to observe as in depth as they probably did back then. It requires intent observation, close observation, and the ability of the practitioner to autodidactically acquire the ability to read in people's faces, to recognize different remedy faces and different deficits of mineral salts. But it's doable, and he stressed it also in his writings that this is not a diagnostic approach as a standalone, but it can help us. And for example, a magnesium phosphoricum deficit shows in a gentle redness of the cheeks on either side of the nose, or a facial general rubescence of suddenly rising blotches. Molinus, a practitioner of the time, called these hectic blotches. A lack of Kalium muriaticum, on the other hand, gives the patient a milky colored pallor, beneath which smaller blood vessels are accentuated in a bluish hue. And this is particularly expressive below the eyelids. Helmstetter, another contemporary, points out in his paper on Schüssler that the latter customarily employed tongue diagnosis as well in case taking and in the remedy selection. In Schüssler's own writings and other sources on the functional remedies, there has been no reference to this use of the tongue diagnostic, but that's an interesting tool also to have in the box. Now, for the purpose of this presentation, I have chosen to hone in on the 12 main Schüssler salts, and I'm leaving the adjunct Schüssler salts a little bit to the side. I will make a reference at the end of the presentation to these adjunct Schüssler salts. There is little open access information on the adjunct Schüssler salts, and I found little in terms of books that specifies these remedies in more detail. And in particular, there was nothing, or there was very, very little in terms of issues of the skin. And this is, of course, the main topic. So here I am then referring to the original Schüssler salts for this presentation. So I'd like to look at some of the facial characteristics of the cell sorts before we go into skin issues, just to make it clearer what this diagnostic tool means in terms of identifying what remedy is needed. So for example, in calcium fluoratum, we have a brownish discoloration, furs and wrinkles that are like a fan and wilted skin, capillary wrinkles on the lower lids that start in the inner corner of the eye, lines that have a reddish or blackish tint, and the facial skin may be flaky, or it may look like you're aging early. In calcium phosphoricum, on the other hand, there's a sickly facial expression. It's a wax-like face. I don't know, you may have seen a wax-like pale, pasty complexion. Very interesting. Thin lips, a very dull color of the skin, and a yellowish hue. In ferrum phosphoricum, there are bluish shadows on the inner eyes and a warm redness on the skin. Quite interestingly, ferrum phos is a remedy that Schüssler very often gave in a 12x. That is something that in his writing came through, that ferrum phos, compared to the other Schüssler salts, which were often used in a 6x, as I said earlier, ferrum phos he very often gave in a 12x. And ferrum phos often has red spots and discoloration in blackish and bluish, as I said. And there's a hollow-eyedness where the eyes are a bit retracted into the skull. So these features pertain to those of the face only. However, there are also physical and bodily signs that can be needed to identify a certain salt. For example, we have bad breath, bleeding gums, a fearfulness, a tearfulness, a permanent tiredness, and a fragility of the nerves that can, for example, point to calcium phosphoricum. And caries, weakness of ligaments, varicose veins, calluses on the skin, cracks on the skin, and fissures are characteristic for calcium fluoratum, just as an example there. So it's not that far off to also look at the tongue, as Schüssler was quoted doing. In part 2 of these characteristics, we have calcium chloratum, which has a scaly facial skin that is more whitish gray. There is a milk-colored complexion with reddish or bluish hue. Milia, that can be here or here. Calcium phosphoricum has an ash gray tint to the outer eyes, like the ashes of cigarettes, also on the chin and the upper lip. The face appears grubby. The temples are sunken in. Those are those temples that go in a little bit here. There may be itching and an infected rash. Calcium sulfuricum has more brownish and yellowish discoloration of the inner corner of the eye, on the chin and on either side of the lower lip. There's redness, itching, and peeling skin. There's also an organ affinity that is characteristics to each salt. So ferrum phos is associated with blood and with the bowels. Natrium sulfuricum is associated with the gallbladder, the large intestine, and the liver. And silica with the connective tissue, the skin, the hair, and the nails. So it's not just the facial diagnostic, but it's also the deficiencies that are visible in organ function deficits or in, yeah, a disequilibrium, as he called it so very often. Now, in magnesium phosphoricum, we have a delicate redness of the complexion, markedly on the cheeks or either side of the nose, but the skin is cold. In ferrum phos, the skin is warm. Natrium chloratum, the face has like a gelatinous sheen that cannot be washed off. The pores are big, the chin feels spongy, the face is bloated and edematous. Natrium phosphoricum has an oily sheen on the skin. There's spots, blackheads, heat bumps, choppy cheeks, a reddened chin. Yeah, there's a fatty gloss on the fingers if you sweep across the skin. This is quite interesting. I've seen people like that. They go like this and they have a shiny, fatty skin, fingers. So all the salts have a specific action radius, the areas on which they function. So calcium sulfuricum is essential for the function of the oxygen transfer in the cells. It's also essential for the pigmentation of the upper skin of the epidermis. Magnesium phosphoricum is needed for the appropriate regulation of the autonomic nervous system, for example, just to name a few. Now, the facial characteristics continued is natrium sulfuricum, that it has swollen tear sacs. I'm sure you've seen patients where the lower eyes, under the eyes and tear sacs were swollen up here and here. The complexion can even be greenish or yellowish. There's redness or frost when they're out in the cold. Or the nose can be red. That's the drinker's nose that we know of when the tip of the nose is reddish. Silica has wrinkles and a polished sheen to the skin. There's a glossy shimmer of the skin, a bit like a mirror. And the skin is very thin, like parchment paper. The eyes lie hollow in the sockets. And in calcium sulfuricum, there's acne, pimples, oily skin, compact wrinkles, age spots that are often on the hands. There's a chalk white paleness following shock and trauma. So you can see that also shock and trauma with a specific chalk white paleness may actually lead to calcium sulfuricum as a remedy. So I'm now going to look into the complaints of the skin. I'm going to hone in on those a little bit more. So skin complaints with scabs and hardened deposits, inflammatory skin issues, and then I will look at a couple of mixed complaints related to skin. So what can be characteristic about different skin complaints? Dermatitis, eczema are discharges, cross formation, and eruptions and eczema. Fluids that come from the eczema can be clear or shades of honey. The exudate can be watery or thicker, almost oily. There may be pus and blood infiltration. There can be crusts that are hardened and scruffy. So these are all pointers to different remedies and different Schüssler salts. So this is also interesting of the Schüssler salts. You have to keep in mind that these salts can also be applied externally. They're very versatile. You can use them in very many different forms. You can create an external or a topical remedy by crushing a few tablets and dissolving them in a little bit of water to make a soft paste. Or you can take some tea and dissolve them in some Bellis per anise tea to form a smooth paste, and can then apply this to affected areas. Or you can even mix them into some neutral cream that can be put on the affected skin. So they're very, very versatile. You can use them in very many different forms. I'm going into some other forms further in the presentation. So let's look a little bit at the complaints with scabs and hardened deposits and the associated remedies. So we're looking at calcium fluoricum. that has cracks, fissures, hard crusts, and particularly on the palms of the hands. We have calcium phosphoricum that has crusts that are whitish or yellowish in color. Kalium chloratum has a mealy-like scurf that's like dandruff and flour, very dry. Kalium phosphoricum has oily scales and crusts, and they smell fetid. Profuse scaling on the upper skin, on the epidermis, is kalium sulfuricum. Natrium muriaticum has white scales. Natrium phos has honey yellow crusts, and natrium sulfuricum has yellow scales. So quite interesting if you see the different natriums, what different expression they have on the skin. Silica, well, there are characteristics. They're yellow and usually purulent. So another form of administration that is interesting in the case of skin issues is that of bathing or actually washing the affected area with water in which the corresponding salts have been dissolved. So keep in mind that Schissler always stressed that we shouldn't use too many salts combined or to be given at the same time. So the stimulus and the information in such a treatment is not conducive to giving too much conducive to the recovery if they're giving too much. So even in a bath, the remedy combination should be kept to a minimum or should be done with single remedies, just FYI. So I've highlighted, and I'm sure you all know these, the Pemphigus as an autoimmune condition, forming blisters, sores, and bumps on the skin. Then there's erysipelas, the bacterial skin infection of the upper epidermis, burns and scalds that impact the skin and show in different scales or affections of the skin. And then there's warts as a common skin affection that I want to look at. So that is the next slide. So the weeping of fluids as pertaining to the skin complaints may cause crusts and get inflamed. As in the prior descriptions mentioned, these liquids and fluids can be acrid, milky, bloody. They can be like flour, slimy, greasy, fetid, watery, glazed, glassy, fatty, smarting, burning, salty, even acetose, encapsulated, sluggish, and purulent. So let's take a look at that. That would be the next slide. Dr. Deepak. Oh, no, there we are. No, yeah, sorry. Oh, we skipped that. Okay, no worries. The other one. My mistake. I didn't see you had already changed the slide. Okay, so in inflammatory skin issues, the remedies that I have found from the Schissler salts that I've been looking at. Hold on, now I also lost it. Because there's another, yes, there's another thing I wanted to mention in terms of dosage of the Schissler salts. There is also something they call the hot preparation. For this purpose, 5 to 10 tablets or 10 to 20 pilules are dissolved in hot water. This means that the milk sugar of these pilules will settle at the bottom of the glass, and the water will contain this information of the cell salts. So this water should then be drunken in small sips, but this settlement of milk sugar at the bottom of the glass should be discarded and should not be ingested. This is a mode giving such many tablets dissolved in water and drinking it. This mode pushes the absorption and provides a rapid delivery of salts. So in terms of administration of cell salts, everything is possible, and the salts can be given in varied forms. As I said earlier, we've now looked at topical application. We've now given booster or the hot preparation here in by dissolving tablets and just by dissolving them and keeping them in the mouth. And the stressing, of course, in the hot preparation is to keep this fluid a little bit in the mouth, of course, to get this absorption via the buccal mucosa. So that would, yeah, then be that slide exactly. So as I said earlier, I was looking at the Femigus. We had natrium sulfuricum. The fluid is yellowish. In natrium mur, the fluid is watery and clear. In Femigus malignus, we are talking of kalium phos. The contents is watery and bloody. In erysipelas, we are looking at natrium sulf as a soft inflammation, natrium phos with infiltrated inflammation in edematose erysipelas. The inflamed erysipelas, that we have ferrum phos, where there's heat and fever of the affected area. Kalium sulf promotes the exfoliation. And one mention is of herpes zoster or chickenpox, where natrium mur is actually the cell salt to question. When we're looking at burns and scalds, we're looking at natrium muriaticum for when there are blisters. Kalium chloriatum or muriaticum, where there is a whitish, grayish exudate. Silica, where suppuration has followed. In warts, we're looking at dissolving and moistening the wart with a solution from kalium muriaticum. Or we add natrium sulfuricum in dissolved form, because that draws water from the base of the wart and the warts will fall off. In chilblains, which I came across for this particular skin application of the salts, in fresh and purulent chilblains, we look at natrium sulfuricum, and on Epanerythrium, we look at silicea, and in furuncles at silicea as well. And nat mur, externally applied to insect stings, is a very interesting cell salt. So let me take a quick look at, as I said earlier on, at the adjunct Schisler salts that have a particular affinity to skin complaints. So we're looking at kalium arsenicosum, a skin remedy that treats all affections of the skin and the connective tissue. It's for chronic skin affections. The patients have a tendency to have dandruff. There's itchiness and scaly eczema with extreme itching. Kalium bromatum has inflammatory affections of the skin and connective tissue. Kalium iodatum is indicated where there is pain and inflammation of the skin and connective tissues, muscles, joints, tendons, and ligaments. Besides that, calcium sulfuratum hahnemanni is for the skin and the mucous membranes. Suppurative inflammation is characteristic. The skin is very sensitive and there is eczema. In kalium aluminium sulfuratum, there is inflammation of the connective tissues and wound healing. Calcium carbonicum hahnemanni is where there are skin affections and where there are signs of early aging. And arsenicum iodatum, where there are skin diseases that have a weeping eczema, or if, for example, it's also a very good remedy in juvenile acne. So, and oh, that already concludes my presentation. I've added a couple of references at the end where I have taken all my information from, for those of you that are interested. Some of these are German sources, others are found online and are accessible if you're interested. Yeah, and I think that concludes my presentation for now. Thank you very much.
Thank you. Thank you, Uta. This is wonderful revision of these 12 cells. And I really acknowledge that the Schussler salt are very important And if
Mhm.
you did not find anything important in the case, like in the one-sided disease, where we got only a few symptoms, then there is a choice of
Mhm.
Sonia 6x and the Kali Muradicum 6x. In every kind of eczema or where the uh, eruption is oozing and the skin is looking very dirty. So these two social medicine are working very greatly and in a
Mhm.
perfect manner. But
Mhm.
being a homeopath in this world where everyone is knowing about the science, so what we need to fix our tablets, because many of the company are making the small size of the pills and many of the are making the large size of the pills. So you should concise on your the pharmacy that what the
Mhm.
size of the pills they are making and how they are
Mhm.
making. Initially, Dr. Shushla was not working on the tablets. They are
Mhm.
giving only the powder in the powder form. But by the days, they are forming in the tablet, and you cannot make the tablet without mixing the preservatives. So
Mhm.
remember that the pharmacy is very important, where we can purchase the exact remedy, either in the decimal potency or either in the centesimal potency. But decimal potency is really important, and many of the local companies, like in India and in Asian countries, they are making the salts without the exact preparation of the decimal scale. So you should concentrate on the pharmacy first, what you are actually giving. Even I seen in my practice, only a one tablet twice in a day is enough. If your pharmacy is good, your tablet is really having the calcarea floor 6x, then it's a one tablet or two tablet is enough to take a action. So Calimure and Silicia 6s is very wonderfully work on and every kind of skin cases. So this is from my side, Dr. Shilpi.
Yeah. Thank you, Uta, for lovely presentation. And I really loved listening to your session. And it's a good revision about all the salts which we have been using. But it was really a good revision about how skin can be treated, how the skin ailments can be treated with using all these salts. So now, first of all, I would like to tell you that there are few questions in the chat box. First, I would like to tell what the question has been asked by Dr. Abhishek Duggal. He asked, which salt deficiency causes white discoloration around the eyes? Uta, I think you are muted. We are not able to hear you.
No, no.
No, no, we
No,
are unable to hear you.
it was okay. Uh, Uta, please switch off your second ID. I think there is no voice.
There is no voice.
Now we can hear you.
Yes, 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 yes. Tell again.
Again, it's
No.
gone.
Is it working now?
Yes,
Yes,
it
yes,
is.
perfect.
Yeah.
Yes.
Okay. That depends on what you mean by discoloration around the eyes. Do you mean just the skin, or do you mean the formation of white milia around the eyes, which also give a discoloration? Um, I, off the top of my head, I don't know if that was in the list. I can't say off the top of my head right now. You'll have to look into the materia medica of them. There is actually, I wrote a small materia medica on the Schistler salts on Clever H. You might want to look into that. And as I did mention in the, wait, let me check, there is Milia. I just saw your comment back there, because I did mention Milia up here in one of the the pages that I was referring to the remedies to, that had specifically a Milia. Off the top of my head, I don't have it in my head right now, because I was, yeah, there it is. Kalium chloratum, Kalium muriaticum has Milia around the eye, so that would be one of the remedies. But do check out the materia medica. I wrote an article on them, or actually two, on the Schistler salts for Clever H, the mag. It's at cleverhthemag.com, and I refer to skin issues and signs in the materia medica. You might find information there. To be specific, I don't have all of the salts in my head as of now at the moment. But thank you for asking. I hope I can help with that. Then there's the question, any specific protocols for which salt for different skin diseases, if any? Protocol, there are no protocols, because as Schistler said, you're supposed to take them one by one and not to intermix them or intermingle them very much. So I would say it's very specific of who your patient is, what the general picture is of the patient. I would think that in a lot of cases, we will need a constitutional prescription in skin diseases. So it's a toolbox. I very much look at the Schistler salts not as a standalone therapy, but I look at them as an adjunct tool in my toolbox, a very important one by all means. But I look at them as something that adds to what we already have. So there is no specific protocol that makes life easier. And you say, okay, you've got this on the skin, now take these remedies and it'll be gone. I'm sorry, they do not have that.
No worry. So listen, everyone. UTA is not limited to the Clever Edge. UTA is also a COO and Chief Operating Officer at Homeopathy World Community. I am an Executive Director of that Homeopathy World Community, and Dr. Shilpi Arora is also a prestigious member of Homeopathy World Community. So every homeopath, we are connecting throughout the world through this community, and I also request all of you to please join Homeopathy World Community. And for every article, even in the for the biochemic or any kind of disease or any kind of the peer-reviewed article, you can find on the cleverthemug.com. Uta is the founder of that Clever Edge. Uta is the chief editor, and Uta is everywhere. You can find her on that
I'm all
website.
over the place.
So Homeopathy World Community is also a big channel, and I advise every homeopath to please join the Homeopathy World Community and join us at different kind of activity of Homeopathy World Community. So thank you, Uta. Thank you so much for this lovely presentation, and the short in the shortest time you cover all the things. So thank you so
Thank
much.
you for having me.
Yeah,
It was a
Dr. Shakti.
pleasure.
Yeah.
And I have to say a word about working with Dr. Deepak and Dr. Shilpi. They are an integral part of the team at Homeopathy World Community, and we would not be the fantastic community that we are without the two of them. So if you're interested in events that are going on, if they're interested in being part of a community that keeps growing, that explores, researches, and works for homeopathy, then Homeopathy World Community is a place to be. Thank you so much for having me, Dr. Deepak, Dr. Shilpi. I very much appreciate the opportunity. Thank you so much. And everybody, thank you for being here and listening to my presentation. Thank you so much.
Thank you. And
Thank you.
still, if anyone have any question, you just write to us. We will forward to Uta, and she will give you a reply. So thank you,
Yeah.
thank you everyone. Dr. Shilpi.
Yeah,
Thank you.
yeah, thank you. Yeah. So anyone having any doubts, please feel free to message us and we will take your queries to Uta and to the respective faculty members, whichever you want to have a query with, and we will reply it back. Okay.
Thank you. Thank you very
Thank you.
much.
Thank
Bye-bye.
you. Bye-bye.
Bye. Thank you.
Shall I end the meeting, Dr. Shilpi?
Yes.
Yeah, okay. Thank you.